Let's start with our first section of the lecture, Preterm Labor, in which we will talk about the overview of preterm labor. In this, we will mainly talk about the etiology of the preterm labor, what's epidemiology, what's the incidence of preterm labor and how it occurs. And then what's endocrinology? Endocrinology is the branch of science that deals with the hormones. So we will talk about what are the different hormones that are involved in the preterm labor and in the normal pregnancy, and also biochemistry. So let's start with the section 1 in detail. So now, first let's see what preterm labor is. Preterm labor is the onset of labor before 37 weeks of gestation. The normal duration of gestation is 40 weeks. So if the labor is or begins at 37 weeks, that's the preterm labor. The preterm premature rupture of membranes. Premature rupture of the membranes is the most important factor that can lead to preterm labor. So preterm rupture of membranes. Why there is preterm labor or onset of the preterm labor, mainly the associated causes are if there is decline in progesterone action. Progesterone is the hormone produced during the normal cycles, and progesterone is the hormone that keeps the quiescence in the uterus. So the contraction of the uterus is prevented by the level of progesterone. So as the level of progesterone decline or decreases, there is onset of uterine contraction, and with the uterine contraction there is onset of the labors or the premature onset of the labor. So decline in progesterone action. Then if there is over distension of the uterus, if suppose there are multiple pregnancies, if there is polyhydramnias, if there are associated fibroids with the pregnancy, usually this can also lead to preterm labor. So over distension of the uterus, decline in progesterone action, and over distended uterus, both can lead to preterm labor. Then the third cause can be the cervical disease. Any cervical disease, if the cervix is, if there is infection, if there is cervicitis, if there is abnormality in the size of the cervix, all these can lead to the preterm labor also, mainly because of preterm rupture of the membrane. So cervical disease is also associated with preterm labor. Then we have decidual senescence is the condition in which there is separation or damage to the decidual tissue. Decidual tissue is the part of the endometrium. Endometrium is the inner lining of the uterus, and this endometrium at a point where there is origin of the maternal placenta, that's the decidual portion. So if there is abnormality in decidual tissue, this can lead to premature or preterm labor also. Then we have breakdown of maternal fetal tolerance. There is tolerance to of the fetus and the mother to the whole physiological state of pregnancy. So that tolerance, if that is broken down, then there is inability to hold that pregnancy, and it can lead to preterm labor also, or preterm delivery. Then another is vascular disorders, abnormalities of blood vessels, if there is bleeding disorders, there is obstruction of the blood vessels leading to hypoxia, anoxia, and reduction in the level of amniotic fluid, which is a fluid that keeps the baby inside. So this can also lead to preterm labor. Stress, maternal or fetal stress, can lead to preterm labor. There can be different stresses, socio-economic stresses, domestic stresses, the stress of being pregnant, stress of labor, delivery, stress of different complications. All these stresses can lead to preterm labor also. Then we have again different infections, in which very common are some viral infections like herpes, syphilis, then we have gonorrhea, toxoplasmosis, cytomegalovirus infections can lead to preterm labor. And then there are some unknown factors also that can lead to preterm labor. Nothing is present, no known cause is there. And then also there is premature rupture of the membranes and preterm labor or preterm onset of the labor. So all these are the different factors that can lead to preterm labor before 37 weeks of gestation. Now, etiology, human evolution, there is a theory based on the human evolution that preterm labor can also be associated with the evolution that the humans went through, in which bipedalism is very important theory, in which they believe that in the beginning the animals or they walk on 4 legs, and then with the evolution instead of 4 legs they start walking on 2 legs, and that slowly brings changes in the size of the pelvis. So size of the pelvis plays an important role in the delivery and the labor. So when the bipedalism occur and humans start walking on 2 legs instead of 4, then it leads to the change in the size of the pelvis, and this small size of the pelvis lead to the preterm onset of the labor. So other is encephalization, in which there is change in the size of the skull and size of the brain. Also then this can lead to the evolution of or the activity of the brain from non-cortical part to the cortex. So this also brings changes in the different factors that can lead to the preterm labor, because brain and the pituitary and hypothalamus, all these play a very important role in the maintenance of pregnancy. So slowly these changes that occur over time, they cause a decrease in the size of the changes in the size of the brain and the activity of brain that can lead to preterm labor. Then the epidemiology. Epidemiology can be the preterm labor, can be iatrogenic or medically indicated delivery. So preterm labors, we can have like some procedures can lead to the preterm labor, and also there are some medical reasons for preterm labor, like conditions like eclampsia, pre-eclampsia, if there is gestational diabetes, certain other conditions, infections, all these can be the reason for inducing preterm labor. So this can be iatrogenic, means self-induced as a result of some procedures or medically indicated deliveries. Preeclampsia, condition in which the blood pressure is raised, maternal hypertension, which can lead to dryness of amniotic fluid or decrease in the level of amniotic fluid, and then ultimately can progress to eclampsia, in which there is elevated protein levels and there are seizures, all that can occur. So all these complications are these are the factors that can lead to the preterm onset of labor. So preeclampsia, fetal growth restriction, and maternal cardiac or renal conditions can cause lead to preterm labor. Some facts about the incidence of preterm labor. Out of 15 million babies born preterm every year, 1.5 million die as a result of preterm onset of labor. The newborns usually are premature, and that leads to that's the main reason of the death is the underweight and premature infants. So 5 out of 15 million, about 1.1 million die. This is the statistics showing different parts of the world which have higher incidence of preterm labor. The red is the one, these are the areas with the highest incidence of the preterm labor. Then slowly as we go to the yellowish portion here, these areas, they have the lowest incidence of the preterm labor. So these are the countries usually which are the underdeveloped countries, not developed countries. And underdeveloped countries have higher incidence of preterm labor mainly because of low rate of antenatal care, higher incidence of infections, and those causes that can malnourishment that can lead to onset of preterm labor. The percentages, 25% of the cases are mainly maternal and fetal indications. 50% are usually spontaneous preterm labor. In 50% cases, it's spontaneous onset of preterm labor and nothing is present. And 25% follow premature rupture of the membrane. So these are all the incidents of premature labor. 25% mainly because of maternal and fetal factors. 25% are due to rupture of membranes. 50% is spontaneous onset of premature labor. Some factors associated with premature labor also, socioeconomic factors, marital status, married or unmarried, environmental stresses, cigarette smoking, illegal, and then substance abuse, alcohol, and poor nutrition. All these are very, very important factors that contribute to the onset of preterm labor and preterm delivery. Then endocrinology and biochemistry of labor. If we see in this graph here, these are the weeks of gestation and then the quantity of different hormones present during the pregnancy. HCG is the human chorionic gonadotropic hormone, very important hormone of the pregnancy. The first indicator that the woman is pregnant, done by the pregnancy test, is detected the HCG level, human chorionic gonadotrophic hormone. If you see raises high in the beginning of pregnancy, and then slowly declines as the pregnancy progresses. The other hormone is the prolactin. This is the prolactin hormone that helps in the production of the milk by the breast tissue. It also increases little late in the pregnancy and keeps on rising until the 40th week. And then the progesterone and estrogen are the other two hormones produced. They are very low in the beginning and slowly they keep on increasing. And progesterone is very important hormone to prevent the contraction of the uterus. So as the progesterone level increases, it increases later on in the pregnancy. Pro-pregnancy factors is usually we have progesterone, we have relaxin, human chorionic gonadotropin, pro-relaxation prostaglandins like prostacyclins. All these factors causes relaxation of the uterine muscles, so baby can grow inside the uterus, because contraction can cause miscarriages and abortion. So it's very important that during the early period of pregnancy, we should have the normal pro-pregnancy factors present that keeps the uterus quiescent, relax the muscle and protects the pregnancy. All these inhibit the contraction of myometrium. Myometrium is the muscle layer of the uterus, and contraction of this myometrium cause induction of the labor or preterm or the term labor. So it's very important that myometrial contraction should be avoided to avoid any preterm labor. So that was all about section 1. Thank you for watching sqadia.com.